And welcome to Talk of the Town. I'm Robyn Zimmerman. Dieesha Hicks has joined us for her monthly visit. As you know, she is the State Health Insurance Assistance Program Manager for the Lowcountry Council of Governments. And today we're talking about the Medicare Advantage Plan. We're in open enrollment. It's about ready to end. And so it's important that we go through the details and really just do a deep dive into what it is and when the opportunity for enrollment will end. So Dieesha, let's just jump right in. What is the Medicare Advantage Plan?
So Medicare Advantage Plan, better known as Part C. So Medicare Advantage are individual private insurance companies that are contracted by Medicare to handle people's insurance. Most of them have the drug plan included and also include dental, vision, and hearing. So some of your big companies, like Aetna, AARP, United Healthcare, Blue Cross, etc.
So let's talk about the advantages and maybe some of the disadvantages of being in the Advantage Plan. Let's talk about the advantages first.
Some of the advantages are some people just really want to have that dental, vision, and hearing coverage that's not covered by original Medicare. And also they get everything just all in one card, including their drug plan. So they have one card, they can use it at the doctor and at the pharmacy, at the dentist, and when they're getting vision care. It's cheaper on the front end. Most people don't have to pay anything additional to have that Medicare Advantage plan. And they do have max out-of-pocket costs.
What about like the deductibles and co-pays? Are they fairly high?
It depends on the plan. Most of the plans do not have a health deductible, but some of them do. So it just depends on that particular plan. And another thing people should look at when they're picking these plans is making sure that their doctors are in that network and that their prescriptions are covered.
So if you have the Medicare Advantage Plan, which I don't, I have just regular Medicare, and then I have a supplemental. Do you need a supplemental with the Advantage Plan as well?
So it is illegal for you to have a Medicare Advantage plan and someone sell you a Medigap policy. They do not coordinate together. You cannot have both.
Okay.
So if you have Medicare Advantage plan, that is your plan.
There's your plan
supplemental
for everything. And does that come out of your Social Security as well?
If that particular plan has a premium, you could get it deducted from your Social Security.
Okay. So I mentioned earlier those are some of the advantages. The disadvantages, I think you mentioned your doctor needs to be in that network. Anything else?
Another disadvantage sometimes is getting those documents that are necessary to get those claims paid, or people not understanding the appeals process or what's included in that plan. Particularly people that have chronic conditions, and they may just need to see a specialist that's not in their network. Sometimes that could be get a little bit expensive.
All right. So are you seeing from your work, Dieesha, more folks moving to the Advantage Plan and out of regular Medicare?
And I believe the thing with that is that that's what they see on TV. That's the commercials they hear. They see it on Facebook. Their phone is ringing all the time about a Medicare Advantage plan. You see the commercials everywhere. Their neighbor is like, I have this, try this. So I think that it's so in their face. A lot of people tend to go that way, and it's just sometimes cheaper. So it's just cheaper for them to just have a Medicare Advantage plan versus getting original Medicare and a supplemental.
And again, you said it involves different companies, but does most is like surgeries and all of that completely paid for with that? I mean, I know with my Medicare.
So you're covered at pretty much 100%.
Yes.
But if you have a Medicare Advantage plan, you're still responsible for your co-insurance.
Okay.
So the co-insurance is this is what your company agrees to pay, which is usually 80% of the allowed amount. So after that is made, if it has a deductible and that's met, then you'll be responsible for that 20% co-insurance that's remaining out of that allowed amount.
Okay. All right. So we're in open enrollment. So when does it end, Dieesha?
So we are getting to the end of Medicare Advantage open enrollment. It ends March 31st. That will be the last day to change your Medicare Advantage plan if you're having any problems with it. And during this time, you can switch from one Advantage plan to another. If they want to go back to original Medicare, they can switch to a independent Medicare drug plan, and that's switch them back to original Medicare and get them out of that Medicare Advantage plan. So those are some of the options they could do during this time.
Good. Well, thank you, Dieesha Hicks with the Lowcountry Council of Governments. Appreciate all of your great insight, and we'll see you next month, right?
See you next month. Yep.
Okay. Bye, Dieesha.
Bye-bye.